And we're back at 6:15 on a Tuesday morning. Have you ever, Cassandra, felt there was something infesting your arms, your legs? You felt there was something crawling, you couldn't see anything, you just, or you went outside under a tree and perhaps you thought it was ants, it was just some kind of thing? And there was nothing? But there's such a thing, it's called parasitophobia.
Wow.
Yeah,
So
let's get the doctor's perspective on this. We say good morning to Dr. Andrew Ford, or dermatologist. Good morning to you.
Good morning, guys.
What is
Good morning, viewers.
parasitophobia?
Well, it's called the delusion of parasitosis. It's when you
She's
hold...
delusionary. You saying that my
complex.
colleague is delusionary? Or delusional?
It's when you hold fast to a belief of infestation, even though you have superior evidence that the infestation does not exist. And it's unshakable.
People come to the dermatologist for this?
Yes, they do. I saw someone up to yesterday with it. Yeah.
With parasitophobia?
Yeah, it doesn't happen often, maybe once a year. You get a patient with
Once is too often.
So wait, break this down for us. You mean people feel like things are crawling on them all the
Yes,
time?
there's a sensation and a belief that there's something living on or just under the skin, or it can be near to an orifice of the body, and the individual sees and can feel it, and they spend lots of time trying to collect the evidence that such a thing exists. So one of the presenting complaints, one of the things a patient would do is to bring you evidence, which would be little bits of debris or maybe some dead insects or bit of hair, and they bring it in a container or they put it in a box or in paper, and that's called the matchbox sign. But the type of patient that presents in this way varies. Some of them are primary, where the individual is totally normal, and this is an example of what's called the matchbox sign. This is a vial that contains lots of broken pieces of skin and debris and little bits of nails and that sort of thing. And that's what the patient believes is evidence of the infestation. And they really require you to look at it very carefully, look at it under a microscope. But the type of patient varies. Some of them are normal to all intents and purposes, and this delusion is just their one preoccupation. But then there are others who may have psychiatric conditions like schizophrenia, or they may be depressed or bipolar. And then there may be those who may be on some sort of drug, recreational drug. And then there are others that may have systemic problems related to the thyroid or vitamin deficiencies and things like that.
How do you respond to that situation?
This requires great tact as a clinician to respond to patients like this. As I said, the delusion is fixed and unshakable. This photo just shows that someone took a razor blade and surrounded an area on the hand that they were convinced had evidence of the infestation. It requires a great deal of tact because you have to get the patient's trust, and this trust takes a period of time. This is from the internet. You can see all the gouges. The things that you see clinically are not primary, they're secondary, meaning that it's not something caused by the infestation, it's caused by the patient trying to actively remove bits of skin that they think have the infestation. They may think it's mites or worms. This is an elderly gentleman who was picking at his head and face because he was trying to remove the things that he can feel and thought he could see on the skin.
Well, let me ask you, how do you account for people who present with something like courage?
Well,
because you can't see anything, but and if you don't know about courage and you have this severe itching all over your body,
well, usually, you have to go through the same process of a history and examination. So with courage, it will be different. There's a certain mentation and a look of this patient. The story is different, but the belief is unshakable. Nobody else has seen it, but there may be, in the case of courage, there will be a history of courage being around and they'd get a sticking or pricking, but they won't have it all the time, and certainly it wouldn't have persisted for months every day with nobody else being affected, because courage would affect whoever is in the neighborhood or the vicinity.
Wow. Okay. So what do you do to make this particular patient feel better? And maybe you can explain what we're seeing.
Yeah, what you're seeing now is someone who was thinking that this infestation was in the toes, and they've spent a lot of time picking the skin off of the big toe, just trying to get rid of this infestation, worm, mite, whatever it is they thought was there. Sometimes they just say it's something that's living in there. They can see it. It moves around. It's wiggling, different things like that. So, and the relatives become really concerned, and after a while, they seek help. But this patient would have gone to several doctors because they would become obsessed with cleanliness, and sometimes they would present with irritation due to cleaning products and disinfectants. They may have got the help of entomologists or people who clean houses, and they would have seen numerous doctors and been dissatisfied. So that's why you call doctor shopping. They would have gone looking for it, and anyone who challenges or says something that challenges their delusion, then they move on. So you really have to get a lot of confidence and talk to the patient, but you cannot buy into the delusion. There are situations where you can have craziness of two, because sometimes a relative can buy into it, or sometimes there are cases where a doctor has suggested and someone then takes on the delusion. So I mean, they're less common, but it's important not to say, okay, I'm going to give you these tablets and this will kill what's in your skin. When you use a doctor, after looking at the patient and talking to them, know that there's nothing there, because all that does is to reinforce and strengthen the delusion.
Well, how do you, what do you do? Because like
well,
you
it
said,
depends
you
on the
can't give them
cause. It depends on the cause. If the person is normal and has no psychiatric problems. Oh, this is just another example of the matchbox sign. The person bought paper on the left side, you see a bit of hair, one or two little bits of debris on the other side. On the right side, lots of little dots of dead skin, basically, that the person rolled up as the evidence, because they spend most of their day trying to collect evidence that.
But can dead skin cause the sensation as well? I mean, if you've got the scaly skin or some
usually
kind of
no,
rash?
that's usually imperceptible. But you can, if you have that delusion, you're gonna really try to find evidence of it. So depending on the cause, if the person is to all intents and purposes normal, then they may, reasoning might be enough to get to them. If they have an underlying psychiatric condition, you treat it. In that case, it would be with oral medication.
So would you then have to do a referral? Or
Yes,
do you work with
it's
other
usually
doctors?
a multidisciplinary approach.
Right.
Psychiatrists, dermatologists, you usually need to get more than one person on board to sort
I
it
would
out.
not have thought.
I can tell you something that happened to me. I had this sensation in my ear for a long time. Couldn't, and I thought I was going crazy.
And Cassandra Cassandra mentioned that to me.
It was Cassandra. No, but it was just a hair.
Yeah.
It's a hair that was growing, and you couldn't really see it, and it just kept tickling you and doing this thing.
Thanks for the ammunition.
Perhaps I shouldn't have. Dr. Always good getting your perspective. Parasitophobia, something new. All right, we're gonna take a break here.
Yes, we will.
We're gonna change topics, please.
Thanks for sharing, Doc.
We'll be back.
All right, we'll be back.